everyone. Hi everyone, my name is Modoni Gishovi from Rescue Pets Kenya, and today I am joined by a very special guest, Dr. Allan. So, karibu sana daktari.
Thank you very much for having me here.
Absolutely welcome. Please introduce yourself.
Hi everyone, my name is Dr. Allan Keya. I am a small and companion animal vet. I run a practice by the name Ela Veterinary Clinic that we're based in Ruaka, but we serve the environs of Kiambu, Nairobi and Nairobi Metropolitan.
Awesome, thank you. So I promised you guys I would bring a vet on this show, and we have a vet here to answer all of your questions. So today we want to tackle the topic, what should I know when I want to adopt or to bring an animal into my home? How long have you been in practice?
It's been 10 years, starting the 11th year very soon.
Wow.
Yeah,
And what
so
are
a short time.
What are your favorite animals to treat?
Honestly speaking, as a veterinarian, you really don't have favorites. So, but I'm more biased towards small and companion animals, and basically this revolves around the dog, the cat. We see a few of exotics, namely reptiles, for example, terrapins. We also handle birds, cockatiels, cockatoos. We African grey parrot, but those ones are considered wildlife. So if you're to keep one, you'd need a special license from KWS, and yeah, pretty much that. So we also see a lot of ornamental fish. Okay, so aquarium setups are becoming very common in Nairobi, going by the space available. So in a nutshell, that's what we see.
All right, awesome. Terrapins. I was waiting for you to say iguanas, snakes.
We are getting there.
Dogs and cats are the most common
Yes.
pets found in Kenya.
Yes.
What vaccinations are necessary,
Okay.
and at what age?
Okay, that's fine. So, so dogs and cats. So dogs and cats get different vaccinations. Okay. So maybe if I can take you through the regime. Let me start with cats maybe. So we start the vaccinations as early as 6 weeks. We normally do booster vaccinations every 3 weeks, but the normal practice in Kenya is that we do the first jab at 6 weeks, then do a booster at 12 weeks, and the booster would involve both the cat flu and rabies. And as you know, rabies is zoonotic, so just to protect the pet and also the owners that are handling the cat. Then we do annual boosters depending on the area you are. If you stay in a place where rabies is endemic meaning there have been cases of rabies reported in your neighborhood, then it's encouraged you do another booster. But around 6 months, then normally you just do the annual boosters every year. So that's it. That's in regards to cats. For dogs, first vaccine is at 6 weeks, and that's the parvovirus. Then we do a booster at 9 weeks. That's canine distemper, hepatitis, leptospirosis, parvo, parainfluenza.
Okay.
Then we do another booster of the same at 12 weeks. Now we introduce rabies. Then depending on the breed type, if you have the large breeds like the Rottweilers, the German Shepherds, which are commonly referred to as working dogs, you do a booster of parvo at 15 to 16 weeks.
So should I be brushing my dog's teeth?
You can and you may not, okay? Because there are different ways of going about it. So One is that we encourage if your dog can be on a kibble diet. And basically kibble diet are the pellets that you see dogs feeding on. So as they crush on those pellets, they'll be able to naturally clean. Okay. There are also things that in the market, products like dental sticks, as they chew on those products, and normally they come in as treats, they'd naturally be able to clean. We discourage giving dogs bones, but if you may, you look for the very big bones, yeah, the ones that they're not able to crush. So as they tear the flesh out, they also would be naturally working the dental hygiene. Okay. But if your dog is cooperative, especially for the pet, like like the house dogs, those ones you can just use your your toothbrush, like what you'd use for a child.
A soft one.
Yes, and the dental pastes, proper recommended animal dental paste, and you can just regularly do that. And the idea behind dental hygiene is because basically the mouth is the entry level to most of the things in your body. Okay. So we need to keep the mouth clean to keep all other organs clean. Okay. Yes.
I think we need to figure out a way to brush cats' teeth as well.
I wish you luck as you endeavor.
So tell us about deworming.
Okay.
Yeah.
For deworming, we start as early as 2 weeks, when your pets are 2 weeks old. That applies both for the dog and the cat. Reason why we start it that early is because some worms are passed from the mom to the newborns while they suckle. Okay, so we start as early as 2 weeks. We repeat the deworming every 2 weeks until the pets turn 3 months. Once the pets turn 3 months, we do it monthly until they turn 6 months, and once a 6 months, every 3 months, but depending on your setup. Like for example, cats that are indoors, that are not fed on raw diets, those ones would even just be doing the deworming every 6 or so months. But if they're going outside, they're getting exposed to raw diets, you have to stick to the regime.
Okay.
Yeah.
All right. Let's move to grooming.
Okay.
And let's start with cats.
Yes.
We have both short hair.
Yes.
I think medium hair.
Yes.
And long hair cats.
Yes.
What does grooming for cats, especially indoor cats, look like?
Okay. First, I must note that cats generally self-groom, okay? The only thing then with that information that clients need to know is that depending on the coat type of your cat, different cats would be predisposed to different conditions. You've maybe heard about fur ball obstruction because cats really lick themselves, and especially the long-haired type. If they're not regularly groomed, and regularly grooming means I recommend at least thrice a week, okay, and the different products in the market. So you want to get also a proper product. So you've seen these gloves that you're able to put on your hand, and normally we recommend to our clients to run against the grain, okay? Like for example, this is the head and this is the tail, so you run against, get as much fur, dead fur out as possible. Then once you're done, how you know you're almost done is that once you remove the chunks from the glove, when you're having very minimal fur accumulating on the glove, you know we're pretty much done. Then you can do your nice styling. So the working dogs you do once a month. For the guys who sleep and join us in our beds, depending on also on the setup, we recommend maybe every fortnight.
Okay.
But if you have one of us who like digging your garden and they're showing up with a muddy paw, yes. So maybe you'd want to be a bit more regular. Okay. What I discourage, and I've seen it, and people do it out of, allow me to call it ignorance, guys giving the pets a bath every day.
So Daktari, tell us about nutrition. What should my pet be eating? And what's the difference between what they should be eating if they are a working pet and if they are a companion pet?
In terms of the diet or the nutrition, One, if your pet, especially for the dog, is a working type, so you need high energy diets, you need high protein diets, basically to replace and work on the muscles and the tissues as a result of activity. But as a basic rule, when they are born, once they're weaned off from the mom, you start feeding 3 times a day. You'll drop it to 2 times a day once your pet, be it the dog or the cat, turns 6 months. Then once they are a year or older, you can drop the feeding to once a day.
In the event that I'm not giving my young animal commercial food,
Yes.
what should they eat?
You've heard of omena or daga. Yeah, so
Okay.
basically these are the small fish. And if you're doing a meat diet, what I also must advise clients is that it needs to be boneless. Reason being, if you're giving beef, fish or chicken that's bony,
Yeah.
in the event that your cat or your kitten does not crush, because you see what happens with cats, what people need to know is that cats don't chew. Cats crush and swallow. Okay, so in the event that you're having a pet that is doing that and you're having your bone a small piece, so there's a risk of choking or even the bone going in and causing perforations in the intestines, which is actually life-threatening.
Yeah.
Or just issues of constipation. You'd hear a client tell you, my pet just has issues passing normal bowel movements, and pretty much the victim there is like a small bone, the small KFC, non-spicy that we like to give them. That's what causes the trouble. So if you're sticking to the meat diet, let's go boneless, okay? Fish, let's do fillet, and we should be good.
Okay.
Yeah.
And in fact, the constipation issue hits home
Yes.
sana for
Yes.
me, because
Yes.
the last time I was with Doc, it was
Yes.
because my cat was constipated.
Yes.
Because
We're
of
not pointing fingers.
KFC.
We're not pointing
Okay.
fingers. Yes.
All right. Thank you so much for all the answers that you've given here today. I'm sure a lot of people are satisfied with the answers that they've gotten here. So in case you want to get in touch with Dr. Allan, so how can we reach you?
On Facebook, Ela Veterinary Clinic. You can also write to us, elavetclinics@gmail.com, and we'll be able and glad to respond and support you in that journey.
So I will also place the links to his pages in our description box, and then you can go ahead and get in touch with him in case you need any more clarification. Hi everyone, I'm back and I have some amazing news. If you want to support the Rescue Pets Kenya channel, now you can, because we have merchandise on sale. So we have this t-shirt. It says, I like big mutts and I cannot lie. So yeah, I like big mutts and I cannot lie. It's going on sale at $11.99. That's 1,199 shillings. And all proceeds go towards production and the assisting of animals towards better lives, treatment and healthcare. If you like the content on this channel and you would like to give, we have a pay bill. It's 5700485. In case you have any more questions,
Yes.
All right. So for small kittens,
Yes.
I've seen people sometimes use
Yes. Feel free to catch us on our
the parting shot napeana ama ni hiyo tu. It's just that part.